And we're back on Morning Barbados with our dermatologist, Dr. Andrew Ford. And we're talking about a unique skin disease that we see quite often. It's called erythema multiforme. I got it.
You did.
Yeah.
Better
And,
this time. Erythema multiforme. I can do it now
You
that
can
I've
do it.
heard
Yeah,
it.
you've heard it a
I
couple
just
of
don't want to
times.
risk it and call it something
Yeah, yeah.
ridiculous.
I'm just wondering, when you look at those sores and, and the blotches, people are worried about whether a condition like that is contagious.
Yeah, the condition isn't contagious, fortunately, and it isn't genetic either. If your relative gets it, you don't get it. The only thing that could happen is if bacteria is a secondary infection on it, and you have a scrape or a cut, then you can maybe get a bacterial infection. But it's quite interesting that herpes simplex, the cold sore, the type 1, is such a pervasive thing in the population. Over 90% of people have herpes simplex. It's just that a lot of us don't manifest the signs of it. So with something that's so pervasive, it is possible, if you're prone to erythema multiforme, that you can develop it at intervals. So for those individuals, then they require some treatment, a preventive treatment. You can take some antiviral medications on a daily basis that can suppress the manifestations of the herpes simplex type 1, and therefore stop you from having the erythema multiforme.
Is there an aggravator, like a primary, is stress a...
No, it's usually a simple thing, usually an infection or medication. And there are other infections, let's say hepatitis, even HIV infection, some other simple infections from viruses, type of pneumonia, bacteria infections that can trigger it too.
So you
but
can't eradicate, just manage.
Yes, but you also have to know that there's also a big idiopathic group. In a lot of conditions in medicine, people get it and you just can't figure out why. And in that group, they aren't recurrent. But sometimes you can do all sorts of tests and someone has it, you don't know why.
Can you misdiagnose it?
Certainly, because there are so many things in dermatology that look similar. It all comes down to the history and the examination. But you can also use a skin biopsy if you are uncertain. But most of the time, the condition is diagnosed by the distribution, and also looking for that target lesion. That's the important thing.
I know, because I'm
So
thinking
Mucous
that
membrane involvement.
if you get a burn and after
Yes, it can look the
blisters,
same, like the picture of the lady with the erosions on the legs, the circular ones. That could easily have happened from some hot water
or hot
falling on her
oil
leg.
frying
Yeah,
in
so
the
that,
kitchen. And that
a
kind
lot
of
of these
thing.
things look
There
very
you go.
similar. So you have to be aware and just know the story and look at the patient properly.
Yeah, but if you get this condition and you apply whatever you think it would work for a burn,
Yeah.
would that create other complications?
No, it wouldn't. But you have to also understand that a burn would be asymmetrical or unilateral, while something caused by this condition would affect both legs. If it's on one leg, it's going to be on the other.
Okay.
Oh, okay.
So when this first appears, it is flat.
Yes, it's
and-
flat, it's red.
but
Depends on
reddish.
your skin color. For a darker person, you wouldn't appreciate the redness. It may just look swollen. But then you will, on the
Cassandra will
palms
be different.
especially, you can see the center either getting, that's funny, Doug. You can see the center either getting a blister or eventually an erosion and getting darker. So when it's healed, you get a discoloration after.
Okay, how long does it take for the healing process?
Usually it takes about 2 to 4 weeks, unless you're unless you're a major case or you have a severe bout of it.
Okay. Well, Dr. Ford, on a slightly different note, but skin related.
Yes.
The CryoLife thing I mentioned to Doug, have you heard of this trend where people are freezing the skin in a sense to preserve its good age?
Well, it's something you've read about in comics and seen on TV, but the logic is there. If you can preserve the cells in a state that you can regenerate them, then they'll be in good shape later.
Right.
But we use
Well, you have to die in order
cryotherapy.
for that to happen.
We use cryotherapy predominantly for
Yeah.
therapeutic reasons to kill bad cells or to kill
But so it is used
warts
here?
and that sort of thing. Yes, we use liquid nitrogen is used here. It's used every
It is
Thursday, Friday, and
nitrogen.
Saturday, and we use it mainly for all sorts of skin damage, solar damage to kill or to get rid of simple superficial cancers or warts or sometimes something called molluscum contagiosum. Various things we use cryotherapy for. And using cryotherapy is kind of an art and takes experience to know how much to apply, because when you apply too much, you get a blister and you can get permanent discoloration and that sort of thing. So obviously, when you freeze things, you slow everything down, and You know, it must take a great deal of knowledge to do what you mentioned. But I'm
Yeah.
sure I will look into it and
Yeah, let's
find out,
talk
because we
about
all want
that.
to prolong being here. It's fun being here.
And you certainly don't want to cryo your life away, so that if anyone taps you and you tip over, you just shatter to pieces.
I remember
Right,
seeing
me
that
too.
in Dick Tracy. It
Yeah,
used to be in the
yeah.
comics, yeah.
Yeah, all right. Thank you very much, Dr. Andrew Ford, for talking with us. Today we talked about erythema multiforme. I hope it's been enlightening for you. We'll take a short break and we'll be right back.